Hello, welcome to our Friday webinar. We're back with Dr. Stephanie Lamb.
Hello.
Welcome, Dr. Lamb. And we got Michiko. Michiko doing she's gonna do all the behind the scenes work, which is a lot. So thank you for taking that on. And let's see. So today's topic, what are we doing? We are doing avian cancers part one, right?
Yeah,
Okay, so that means just imagining that since there's a part two coming up, that this is a pretty big topic, right? That
it
needs
is.
two-parter. Okay. So just as we let people, okay, I could tell this is going to be a big crowd. So as you're logging in, let us know where you're coming from, weather reports, all that good stuff. Like to see where our online community is joining us from, and yeah. So in my area, well, how's Phoenix? How's Arizona? Is it?
It's okay. It's not too bad. We had a little bit of a heat wave a couple of weeks ago, but it's a little bit less than what it was before. So it's all right.
You guys get sun. Oh, well, you gave away our. Sorry, yeah. Michiko just gave the download that we're giving away some strawberry nutriberries today because
Nice.
those smell so lovely. By the way, when you open the bag, it just it's like a.
Sorry I gave it away.
All right. Oh, we got someone from Copenhagen, Denmark. Sorry. Hold on a second. Let me. All right. Sorry about that. Rogue bark. All right. So what was I going to say? So you're going to do a screen share. So we've got a PowerPoint going on. If you have any questions, we'll do those at the end of the webinar. How's that? And use
Sounds
the
great.
Q&A button if you have a question. So not the chat. Okay, I'm gonna let you take it away, and I'm gonna mute myself so we don't hear him barking.
Okay, sounds great. Let
Okay.
me share my screen. All right, let's get this slideshow up. Okay, so as we said, we're going to be talking about cancers today in birds, and it's a pretty big topic, and it's kind of a heavy topic to be talking about as well, right? Usually, when we're talking about cancer, it's something that nobody likes to hear that word, but it is a problem that we have to deal with, and so I thought it might be a good time to go over the different types that we see, and give you guys a little bit more in-depth information on them and things that we can do, most importantly. So first off, I just want to go over some terminology. So first, we will say the word neoplasm. So what is a neoplasm? Because when you hear about cancer, tumor, or neoplasia, we use all these terms, and sometimes we use them synonymously, or I even find myself sometimes going back and forth when I'm talking with an owner, like, oh, I'm concerned about cancer, well, it's a tumor. Like, we use these words and throw them around, but what exactly do they mean? So the word neoplasia or neoplasm is a new growth. And what that is it's when cells go through a genetic change to become basically unresponsive to normal like controls for growth and cellular signaling that tells a cell to, oh, I didn't mean to do that. That tells a cell to stop growing. And so those cells don't respond to those normal growth signals, and they just keep growing and keep growing and keep growing, and to the point where they expand beyond what their normal borders are. Because in our bodies, we have different types of cells in different areas, and those different cells need to stay in those specific areas in order to have normal homeostasis, normal life with an organism. And if a cell decides that it is not going to obey the rules that it is supposed to follow, and it grows beyond where it is supposed to, invades into other areas, and sort of grows uncontrollably, that is what a neoplastic growth is. Now, neoplastic growths can either be benign or they can be malignant. We'll get into that next. So the next definition is a tumor. A tumor is simply defined as a swelling. Now, a tumor can be benign or malignant. When they are benign, it means that they're not normal. It's this swelling, it's this new growth, but it's going to stay confined to a particular area. It's not really going to cause the organism any major problems, typically, systemically. Now, I say typically because there are some benign tumors that may do things like produce hormones that could have some systemic effects. But generally speaking, the word benign means it's not going to grow and expand too far. Now, the word cancer actually means that it is a malignant growth. And a malignant growth is when something has the ability to either invade locally or spread to other locations. So these ones are a little bit more sinister, you should say, or we could say. So while a neoplasm just means new growth, tumor is just sort of a swelling, and cancer is, yeah, it's this abnormal growth, but it's going to have a greater ability to spread and potentially be a problem. So where a tumor can be benign and maybe not too bad, cancer really means that it is going to have the ability to spread somewhere. And whether that spread is local and it's locally invasive and just invades into tissues that are right around it, or it metastasizes, which means that it spreads to some other spot in the body. Usually that's where you have a cell that is a cancerous cell. It gets into the bloodstream and it circulates around and goes to different organs. In particular, metastases often like to happen to places where there is a lot of good blood flow to them. And so in mammals, it tends to be the lungs and the liver. I would say in my experience, I don't see a ton of metastases to the lungs in birds. They do happen. I'm not saying they don't. It's just that I tend to see metastases less commonly to the lungs than I do, say, in mammals. And then just one more terminology that's important to know is oncology. You might hear that word, you're going to go to the oncologist or something like that when we were talking about cancer. Oncology is the study of neoplasia. So if your veterinarian is referring your pet to an oncologist, they are referring them to a doctor who their special area of interest is neoplasias and how we manage them. One thing that I come across quite frequently when I'm talking to owners and I say, this could potentially be a neoplastic process or a cancerous process, I very frequently hear owners say, I didn't know fill in the blank species could get cancer. Oftentimes we think about it as more of this thing that happens to humans, but in fact, it really does happen to all different types of species. So I have pictures here of a variety of different species. A lot of people have dogs. Certainly, I've known many people who have experienced some sort of neoplasia in their dogs, but then we also get it in weird exotic species that people don't even think about too much. And all these species here that I have up are pictures of species that I have seen cancer in, not these particular individuals per se, but have diagnosed cancer in leopard geckos and snakes and tortoises. And this picture at the bottom of the betta fish, you actually can see this. This is one of my patients that I had that actually had a cancerous growth right here on the side of his body. And so you can see it right there close to that caudal tail fin that he developed. So, we often even don't think about cancer in fish, but here's an example of one individual that I personally dealt with who had gone through cancer. So it is not a unique thing to humans. It happens to all different species. So since we're talking about birds today, the question is, what kind of neoplasias do birds get? And the answer is there's a variety of different types. This is a pretty in-depth talk of about a variety of different types of neoplasias. So I broke it up into hopefully 2 webinars. I have a lot of information, so I guess there's even the possibility this could potentially turn into 3 webinars. We will see how the information goes here. But my goal today is for us to go over what's in that first webinar 1 box, which is going to be squamous cell carcinomas, ovarian or oviductal adenocarcinomas, testicular tumors, lymphomas, and chronic lymphocytic leukemias in birds. I put those as our first webinar because several of those first 3 are very common that I will see in pet birds. The other ones that we have listed, some are more common than others, and some are pretty rare to see, but have absolutely been diagnosed. This is not an all-inclusive list. There are definitely other types of neoplasia that are out there that I don't have listed here. And it's mostly because some things are a little bit more rare than others. But the reality is you can get cancer or neoplasia or tumor, pretty much any organ can occur. So let's go ahead and get into the talk. So the first one that we're going to talk about is squamous cell carcinoma. And I really did put this as the first type of cancer I wanted to discuss, because I probably, if I had to sit down and look at all the cases of cancer that I have dealt with, I would say that squamous cell carcinoma certainly tops that list. And I wouldn't be surprised if I did data search and found that in my practice where I work, it's one of the more common or the most common thing that I see in birds. So the question is, what kind of cancer is that? What is squamous cell carcinoma? It's a cancer of epithelial cells. So epithelial cells are cells that are like surface cells that line other tissues. So our skin is covered by epithelial cells. Bird skin is covered by epithelial cells, but then also mucous membranes are covered by epithelial cells. And then there's epithelial cells that line other organs and parts of the body as well. When we get squamous cell carcinoma developing in birds, it's really going to usually start off in anywhere there has been epithelial cells, but there's typical locations that it likes to pop up in or has a tendency to pop up in. And I have those listed here. The choanae is one location. The choanae is that little slit that's at the roof of the mouth. When a bird opens up its mouth, if you get a nice yawn on a bird, you'll see at the roof of the mouth, there's this little slit and it connects to the sinuses sort of around their head. And that in that choanae, sometimes we can see squamous cell carcinoma develop. When it comes to the skin, which, the skin is quite broad, right? It's over our entire body. But the propensity that it likes to go to for birds is it likes to go to the preen gland, and I've also seen it quite frequently on the wings. Of course, it can be in other locations as well. I mean, it could be on the legs, it could be on the actual body. It's just the preen gland and out on the wings, for whatever reason, that's where it is most commonly found in the birds. It can also be found in the upper gastrointestinal tract. So, your choanae is not too far and is really within that oral cavity. So it can be in the choanae, but it can also be in other parts of that oral cavity. It can actually go down into the esophagus, crop area. And then it can extend down to the proventriculus. Now, the proventriculus is actually lined by some different types of cells than squamous epithelial cells. They have a different type of epithelial tissue in there. But if you have squamous cell carcinoma that's up in the esophagus, it has a potential to go a little deeper. It can also be present in the lower gastrointestinal tract. In particular, it can be present within the cloaca. You may see people write this as shorthand as SCC. If you're reading notes from a veterinarian, they may write it as that just because it's easy. So we're going to go over the various spots where we can see it in. And what sort of signs we might see in those areas. Because when you have squamous cell carcinoma, again, because there's so many different places where it can be located, the signs that you're going to have a bird present with when they have this type of tumor develop is going to vary based on that location where it is. So if it is developing within the choanae, so in that slit at the roof of the mouth, what may happen is you might identify some sort of oral odor, like there's just kind of a smell from the oral cavity. They may have a harder time chewing or grinding their food potentially, and likely that might be associated with some level of discomfort that they could be experiencing. They may also experience upper respiratory signs. And again, that choanae connects to the sinuses all around the head. So if you've got a mass growing in that choanal area, it could potentially push things off and really make it so that those sinuses aren't functioning the way that they're supposed to. And then the bird could have signs like sneezing, nasal discharge, that sort of thing. Or you might even just potentially visualize the mass. Here's a picture of a little bird. It's a little conure, and it had presented with respiratory signs. So it was having problems with sneezing and a little bit of nasal discharge. And when its physical exam was done, I could see that there was something in the choanae. And these pictures here are showing, I'm going to use the little mouse here so you can kind of see. This little red thing in that oral cavity, this is the choanal slit. This red thing in there is the mass that was developing in that choanae. And then just to show you a little bit closer up view, the bird is under anesthesia in these photos because it was better access for us to actually see the bird. So he has just a little face mask. So he was inhaling an inhalant anesthetic so he could be nice and sleepy. We were able to get that mouth open. We're just using a little piece of gauze to kind of like pull that lower beak down. And we were using a little cotton tipped applicator to kind of just push the tongue down so that we could actually see this mass that was here and be able to take a sample from it. Now, you may not look at too many choanae of birds because, you know, most people at home are not looking at their bird's choanae, but should you notice they open their mouth and yawn, the slit tends to actually be very narrow. So this is actually pretty wide because there's something sitting in there and pushing it off to the side. If we have squamous cell carcinoma develop on the skin, again, like I said, it's most commonly the preen gland and the wings is where it likes to pop up. And when we see it there, the swelling that develops associated with squamous cell carcinoma is often sort of bumpy. There may be areas of ulceration, and they can have this really thickened keratin. So this is an African gray, and on their left wing, we're extending the left wing here, you can see this very abnormal mass. Right up here, this is like the bird's carpus, its wrist area. And this is over the metacarpal area, so where our primary wing feathers come out. And you can see the bird doesn't have any primary wing feathers. Now, I believe these ones are probably damaged by the bird. These are the secondaries, but he doesn't have any primaries here because this thing is growing over this area and is quite abnormal. And you can, when you look a little closer, we can see how it's this thick, gross keratin. And these squamous cell carcinomas, they tend to like to, the body ends up producing these keratin cysts. So keratin is like the dead skin cells that are on the very surface of our skin, bird skin, other animal skin. But when you get these squamous cell carcinomas develop, it kind of makes these dead skin cells kind of accumulate a bit more, and they can have the ability to make these very abnormal, thick plaque-like things. And they'll actually exfoliate easily. So like all I did with this bird was just gently manipulate this and this whole thing came out. Now you can see the end of this tissue is actually rather lumpy and quite irregular with a little bit of hemorrhage associated with it. And that was just a gentle peeling. It came off well. Of course, there was still much more attached to the actual wing that this bird had and needed more help than just having the little keratin cyst part of it come out. And I just realized I should have said this at the beginning of the talk. I do have some pictures in here that can potentially be a little bit gross because they are abnormal tissue development. So I just want to say that at the start here, just in case anybody is sensitive to looking at pictures like this, because it can be a little upsetting sometimes to look at things like this. So that is my disclaimer. Here, another location. This is where we have a bird that actually comes in with it on the preen gland. These two pictures are the same cockatiel. And rather than having a normal preen gland, this poor little bird actually had a quite extensive lesion over the back. And you can see I have the little measurement device right up next to this little bird's bottom. And this is measuring at, probably like 22 millimeters or 2.2 centimeters, which is almost an inch long. So that's pretty wide for this poor little bird. And when this was evaluated, we identified that in fact it was a squamous cell carcinoma associated with the preen gland. Now this is a completely different cockatiel. And this individual, it's inside of the wing. You can see that there's this sort of ulcerated area. Now, this one doesn't have too much thickened keratin, but you can see a little bit of thickened keratin kind of stuck up there. Now, when you're looking at this, or even this area on this little bird's bottom, you know, I can't tell you that that's squamous cell carcinoma just looking at that with my eyeballs. To me, that just looks like this ulcerated area. These sort of darker things, those are what we call hemorrhagic crusts. So basically like when something has bled and you get like a little scab over it, it kind of creates that more brownish, blackish kind of color, trying to make almost like a bandage over the site, right? But underneath there is a sort of nasty nasty ulcer. And, other things could look like this too. Like looking at this, while I show these as representations of squamous cell carcinoma, when I have a bird coming in with this, especially this sort of lesion here in the wing, I can't tell that that's squamous cell carcinoma just looking at it with my eyes. I really have to take samples of that because other things could look like this too. It could also be some sort of bacterial infection or a fungal infection that just got into the wrong spot. And I have a little bit more of a zoomed in closer up picture of that little cockatiel's wing, and you can kind of see how just ulcerated and irritated that tissue is, and you have that little thickened keratin piece. But I mean, definitely a bacterial infection could do that, a yeast infection could do that. And also the reality is birds are absolutely well known for picking themselves and even doing some self-mutilation behaviors. And if they have done some self-mutilation behaviors, they could cause a lesion that looks like this. So this is something where we really, I can't tell you just right away that there's a squamous cell. I might say I'm concerned about something like squamous cell, but I really need to do some testing to find out what exactly it is. If we have squamous cell carcinoma develop in the oral cavity, but not associated with the choanate, just some other location, again, birds may present with signs of having some sort of oral odor. They may have a hard time chewing, or we may actually see some sort of mass or ulcer in the oral cavity. This bird here is also under anesthesia because that allows us to just get a little bit better visualization because birds aren't always super excited about us looking at sensitive areas in their oral cavity. So the bird's under anesthesia. It actually has an endotracheal tube that is put down into its glottis to deliver oxygen and anesthesia to this individual while we're under anesthesia. And the tongue is actually pushed up this way. This is the lower beak. And underneath the tongue, we've got this big ulceration that's quite abnormal for this bird. Again, I can't tell that that's squamous cell carcinoma. That could be just trauma related or maybe a burn, could potentially cause that same sort of appearance. We really need to do some more testing. When we have squamous cell carcinoma in the upper GI tract, when we're getting into the esophagus, potentially the crop, or even potentially extending down into the proventriculus, those signs are going to be a little bit more non-specific. The bird may just be lethargic, may just be kind of not eating as well as it used to, or it may be regurgitating. That's going to be the most specific sign, is that if they're regurgitating, something's wrong. But, we've talked about plenty of other health problems in birds, and there's lots of things that makes birds regurgitate. So regurgitation in and of itself doesn't mean that there is anything like this going on. It just is a sign that you can see associated with squamous cell carcinoma when it develops in this area. Now, I have a series of images here that I'm going to show you that kind of help with this particular case for us to identify what was going on. And if I'm remembering correctly, I think this was a Pyonis parrot. I think I might be misremembering, but okay, first thing first is we're going to look at the initial image that we took of this bird. This bird on its initial image, just to orient everybody to the x-ray, its head's over here, its little legs are back here, and then its wings are pulled up to the top of the picture here. So the bird's laying on its side like it's kind of flying across the screen here. This bird presented with regurgitation. We took some x-rays to see, hey, what's going on? Can we potentially identify something that lets us know what's going on or what we need to do? And what we could see is we have this sort of big thickening up here. And normally I don't see anything like this in this part of the bird's body, because normally the esophagus is quite thin-walled. So we have our crop up here. The esophagus connects to the crop and drains down into the proventriculus, which is about at this location, and that then drains into the ventriculus, which is about here. Normally, I don't see this big thickened area, what we call fluid to soft tissue opacity. So then we need to do a little bit more diagnostics. So we decided to try and define, like, what is that? What am I actually seeing there? We did what's called the barium series, which allows me to get a little bit more definition of what this could potentially be. This really bright stuff is barium. The bird has swallowed the barium, and we're watching that barium move through the gastrointestinal tract to get an idea of what is what. And the way that it fills it up the crop is quite normal. The crop is distensible, so it really will fill that up quite a bit first, and then it starts to move lower down into the lower portions of the gastrointestinal tract. So it comes out of the crop into the upper thoracic esophagus, and then kind of reaches the proventriculus in this region here, and then down into the ventriculus. And when I watch this stuff move through, normally in a bird, I typically don't really see much barium in the esophageal, like thoracic region. It just tends to either go through really quick that you don't catch it, or you just get this tiny little line because it's really quite like small. It doesn't usually really get quite distensible in that area. So this level of barium filling up from here to like here is abnormal. It shouldn't be that thick and full of barium. But what I can see is I can still see that structure that, oops, I was seeing here, this bulging here. I can still see it bulging up there. And what I can say is that it's not, the barium is not filling that whole space. So that tells me that from this edge to this edge, that's thickened tissue. That's not just dilated upper portion of the esophagus, that is thickened tissue in that esophagus, which is very abnormal in that spot. When you look at these barium series here, now it's superimposed over the heart because the heart is lying right in this spot right here. But this level of barium filling up all from, again, about this area to like probably about there, because the proventriculus starts right about here. That level of thickening with the barium is quite abnormal. We usually don't see that. So that definitely tells me that that esophagus is not quite normal. It certainly looks thickened, and I need to go on to figure out why it looks that way. When we have squamous cell carcinoma within the cloaca, what we'll end up seeing is we'll see bloody droppings is probably the most common thing that people will identify. Because blood's hard to miss when you see it in a poop sample, you know, frank red blood, that's not supposed to be there. We all know that. So that may be the first thing that owners identify. They may also say that they've seen the bird do a little bit of straining to defecate, and they may even see a cloacal prolapse. And this is a bird here who, I will say, actually does not have squamous cell carcinoma. There was just a little bit of prolapse that we were managing. But, you know, when I have a prolapse, I often can't tell exactly because the tissue is quite thickened and irritated. A cloacal prolapse is just where they push that cloaca out, but they can push that cloaca out across the vent for many reasons. And when they do that, if that tissue stays out for a period of time, it can look really irritated and inflamed and swollen, or dry, and stuff can get stuck to it. It can look quite odd and be difficult to know exactly what's going on. And so again, if I was concerned about some sort of mass effect there, I would have to go on to the next step diagnostically, which is what we're going to talk about now. In order to diagnose squamous cell carcinoma, the real diagnosis is gotten through a biopsy. And I highlight that in red because you're going to hear me say that many, many times. Because in fact, really, when it comes to diagnosis of any type of neoplastic thing, your way to diagnose it is you have to get a biopsy sample of that area of concern. A pathologist looks at it underneath a microscope, and they look at the individual cells and they look for cellular changes that are associated with neoplastic processes. And then they try to determine, is this a benign or is this a malignant type of tumor cancer that's going on? So if you get one thing out of these cancer lectures or neoplasia lectures, it's that the way to diagnose things, you have to have a biopsy. That's the gold standard. That's how you do it. So when it comes to squamous cell carcinoma that's on the skin, that's in the cloaca, or on the preen gland, those require a simple surgery where we just take a little piece of tissue. Oftentimes we're using something like this. This is what's called a biopsy punch. It is just a really sharp end here that's like a blade on the end, and it has a hollow center, and we can use this to like poke into a mass of some sort, and then it kind of cuts the end of the tissue for us, and we take that little sample and send it to the pathologist. If it's on any of the areas of the skin, the cloaca, or the preen gland, okay, those are areas that we can often easily collect a sample from. When it gets a little bit more deeper, like if say we have something like that picture where I had the esophagus affected, that becomes a bit more difficult because I can't easily access that externally like I can those other ones. Those ones may require something like an endoscopic guided biopsy where the patient is under anesthesia. We put a scope down either through the oral cavity or make an opening into the crop and feed the scope down into that upper esophagus. Or if it happens to be extending further down and invading into the proventriculus, getting to wherever we see the mass effect area and then taking a biopsy with the endoscope may be necessary. So depending upon where it is, may be easier or harder to actually get a sample from. So let's say we have a bird who presents with those signs, we do diagnostics, we do a biopsy, we get the diagnosis of this bird has squamous cell carcinoma. Well, then the next question is what are we going to do in order to help this bird? And the good news is that, neoplasia doesn't always have to be a death sentence. We definitely have gotten better and better. And as the years go on, new things develop and ways for us to manage these cases and ways for us to help these birds have certainly been developed. So squamous cell carcinoma, if it's in an area where we can do a mass removal, that's generally what's going to be recommended. Squamous cell carcinomas are locally invasive the majority of the time. And so we want to take away the local cancer plus a little bit of the normal tissue around. But depending upon where it's at, you may be able to do that easily. You may not be able to do that easily. If we have something on the wing, like that African gray picture that I showed you, where it was on the very tip, honestly, that might be something where we're talking about doing something like an amputation in that area because we're wanting to get rid of that cancer and not having it go anywhere else. Other options we have, there's something called strontium-90 therapy, radiation therapy. You guys already saw these pictures of this particular little cockatiel who had a squamous cell carcinoma on her preen gland that had developed. This little bird did have a debulking surgery done, but unfortunately, by the time that hers was diagnosed, it was quite spread. Again, you can see the size there. So we couldn't take everything away because it was kind of a little bit more deeply invading. So after she got the debulking surgery, she did actually have strontium-90 radiation therapy as well. And strontium-90, it's really neat. It comes as this little like pen. The oncologist actually came over to our office. We put her lightly under anesthesia and just essentially applied this strontium-90 pen to that site to irradiate the tissue and try to kill surface cells. Now, it doesn't have a real great depth of penetration, that little pen. So the more of this that we can take off so that we only have, a little bit of work that strontium-90 has to do, the better. And I will say these two pictures were taken at different times and the way that the bird's standing, I just, unfortunately, I could have done a better job of taking these photos to show comparison. But the first image is before she had her radiation, and this one was several weeks after radiation. And she actually did have some healthy tissue that was you can't see it here because unfortunately here I put the little measuring device kind of covering it, but it really was kind of coming over to the side. And so we had some healthier tissue starting to granulate in that was healing, but unfortunately it was quite extensive. And so we didn't get everything. And she did eventually pass away. She did have multiple other problems as well. But she had somewhat of a response to the strontium-90, not full, absolutely. I'm not saying that at all for her, but it did help to some degree for her. The other thing that I have on here is imiquimod. It's a topical sort of lotion thing that you can apply to areas of squamous cell carcinomas. Just as a side note, one of my birds that I had, my Port Lincoln parrot who had cerebellar problems that I adopted from a client, she actually developed squamous cell carcinoma on her wing. And it was on the inner portion of the wing, dangling sort of from the carpus. And I went to surgery with her and I did resect the squamous cell carcinoma that I could see. I sent the sample that I had resected off to the pathologist. They looked at it underneath microscope and they told me that, okay, this is squamous cell carcinoma, but also they let me know that I didn't get complete margins. And so that's something you will hear your vet talking with you about is when we do a sample of something and try to remove a mass, we often want to send it to assess the margins to see, did we get complete margins or not complete margins? Complete margins means that we cut that whole tumor out. There was some healthy cells around it. We didn't see it invading into those deeper tissues, so we can feel a little bit more comfortable that we may have gotten the entire thing, depending upon the type of cancer that it is, whether or not it likes to metastasize to other areas. Versus if we find that we did not get complete margins, then that means that there's stuff that's still left behind. And even though maybe it looked like we got everything, we didn't get everything. And there is the potential for local spread. And that's what had happened with my port-legged parrot. But I didn't want to amputate her wing because she already had some neurologic problems that made it so she just really didn't balance great. And I was worried that if I amputated the wing, I was going to make those balance problems a whole lot worse. So what I did instead is I actually got that imiquimod cream and applied it to the surgical site. And she actually did recover with that. Now, I highly suspect that I didn't have too much cancer cells left behind because I had a really good response to the imiquimod therapy, but it's something that we don't have a lot of data on in birds. So, as time goes on, we may find that, hey, this actually is a really great thing, or maybe, it has to be only used when there's just a little bit of cancer cells left. Hard for us to say right now, but it is an option. And then other people have done cryotherapy is another thing too with squamous cell carcinomas. Personally, I haven't done that with any of my cases yet, but that is something that people do and have reported some success on. Just a couple more unfortunate pictures of what squamous cell carcinoma can kind of look like. This is a different African gray who developed squamous cell carcinoma on the inner patagium there. And you can see in this picture here, we just have all this sort of black crust. Again, that's that hemorrhagic crusting, meaning that there was bleeding from the site and it kind of crusted over, trying to create some sort of seal and bandage. A little bit closer image with holding the wing as open as much as we possibly could. You can see it's really taking up all the patagium. Here's the side of her chest. Here's where the radius and ulna are, the humerus is. So it's really quite extensive across that patagium. All this tissue is dead. So all this tissue oftentimes can just be kind of flaked away. And you will get some little areas where there is still some live tissue. So you may get a little bit of bleeding, but you can see when we flake that stuff off, like how cavernous this mass looks because it's just full of a lot of dead keratinaceous debris. And we did even debride it even more fully, and you can see the level of damage that it actually has caused to this poor bird's patagium. This bird did end up having an amputation. I don't have pictures of her post-operative amputation, but this is what it was looking like before we went into surgery. We're just trying to clean everything up and get our site as clean as possible before going in so that we minimize any potentials for post-operative infections and that sort of thing. Okay, so that was a lot of information about squamous cell, and I'm looking at my time, and I definitely have a lot more stuff to go over. But you can see squamous cell carcinoma took up so much time because it's really actually a common type of tumor, and it can be in a lot of different places. So let's go over ovarian and oviduct adenocarcinomas as our next thing. So the type of cancer that this is, it's a cancer of the ovary or the oviduct. I have a nice little anatomy picture here. This is inside of a bird, in sort of the back part of their lower abdomen, like here's the vent of the bird. And we have our oviduct over here and our ovary. The lumpy thing behind is the kidney. So that's kind of where it's lying in the back of the bird, the ovary and the oviduct. And of course, where is it located? Well, it's located within the abdominal cavity. It's either on the ovary or on the oviduct. So usually with this particular type of cancer, birds are going to present with sort of this swelling to the abdomen that's rounded, sort of appearance to the lower belly. They may present with difficulty breathing before owners even actually recognize that there's a swelling to the lower abdomen. And, birds are covered in feathers, right? So we don't see sometimes the changes that can happen to the abdomen until they become really severe and sort of push those feathers out of the way. In early stages, that swelling can be totally masked by feathers. So what owners may first identify is just birds having a little bit of difficulty breathing. And why is it that they have difficulty breathing with this particular type of problem? Well, it's because when we get sort of these ovarian or oviductal adenocarcinomas, sometimes they cause a production of fluid in the abdomen. And that's what is being shown here. We have this chicken, and unfortunately, I will say that chickens are kind of the poster children for this particular type of cancer. We see it in them the most, but we absolutely do see this in parrots all the time too. But this chicken here presented because it was having a little bit of difficulty breathing because it had all this fluid on its abdomen that was pushing off on the air sacs that normally extend to the back part of the body. And because it wasn't able to get normal airflow through its normal respiratory system and normal respiratory cycles, it ended up having a little bit of difficulty breathing. So what we did is we put an ultrasound probe on this chicken, and on this ultrasound image here, you can see all this black stuff. That black stuff is actually fluid. Fluid shows up as black on the radiograph, or sorry, not the radiograph, on the ultrasound. On a radiograph, it actually kind of shows up as a white opacity, but on the ultrasound, it comes up as this sort of black opacity. And also you can see the sort of rounded thing here that was probably a yolk as well that was developing, but we actually drained all this fluid off of this bird's belly so that it could breathe a little bit better. You may also have issues with their normal reproductive cycle. So with our parrots, they certainly are not laying eggs as much as chickens are, but when we have this in chickens, it's very common that owners will say, hey, they were laying, you know, every day or every other day, like normal, and they just really haven't laid an egg for the last couple of months, you know, but everybody else in the flock is laying. And so, you know, owners may recognize just a disruption of that normal cycle. I do feel like I don't have owners of parrots mention that as much, because I think, you know, while our parrots can sometimes be frustrating and lay a lot of eggs, they certainly don't lay as many eggs as chickens do. And unfortunately, sometimes with this particular type of cancer, they may have no signs early on. Picture of a parrot here. This is a little cockatiel. We just had her under anesthesia as well. Shows her little head is inside of a face mask, and there's a little bit of cotton balls to kind of cover the end there, so there's no gas leakage. And the way she presented was with respiratory distress. I felt her abdomen, and when I felt that abdomen, it was quite distended. You can see it in these pictures because it's been distended for some time, and it's kind of caused a stretching of the skin over the abdomen. The feathers, she's had a little bit of feather loss because it's been such a chronic problem from here, but you can kind of see how like rounded this belly is. And it's a little bit more obvious when I poke a little syringe into that abdomen and start draining that fluid off. You can kind of see that sort of rounded appearance there. So how do we go about diagnosing this? Well, again, the ultimate answer is biopsy. That is truly the way that you are going to diagnose this particular type of cancer. But usually we're doing other things before we get to the point of doing a biopsy, because the birds aren't coming in saying, hey, I'm worried I have ovarian oviduct adenocarcinoma, and we just know straight to go to a biopsy. That's not how it works, right? Usually they present with other signs, and so we have to do other diagnostics to kind of help us hone in and figure out what's going on. And oftentimes that's going to be some sort of imaging. So, you know, like the previous photo showed doing an ultrasound. Here we have another chicken with getting an ultrasound is one way to assess, because we can look for fluid. Birds normally don't have any fluid in that belly. If they are feeling like they have some sort of swelling, we can put an ultrasound probe, look for fluid, and potentially even look for changes to the oviduct or ovary that might give us an idea of cancer is a possibility. We can also take radiographs. Now, radiographs do have some limitations because what may occur on our radiograph is just that we see this sort of loss of detail in the back part of the abdomen because there's fluid in there, a mass in there, things are getting pushed off. But they can be our first step to say, oh, something's not quite right in that abdomen if we don't feel anything out of the ordinary. And then CT scans may be helpful as well because they can give us a lot more detailed information. That being said, all of these have their limitations, and I have had times where, you know, we did these various diagnostics. We knew something was going on with that reproductive tract, but it wasn't until we went in surgically to see what was going on where we actually found that, oh, it looks like this is probably cancer and we need to take a biopsy. If we have a bird that does have fluid on its belly, then we can analyze that fluid underneath a microscope, see if there's any cells that maybe give us a clue. I will be honest and say that you tend to not have too much help with that fluid analysis in saying this is ovarian or oviductal adenocarcinoma, but it might rule out other things like infectious processes. And then we may also be doing blood work, our regular CBCs and chemistry panels. Again, and with this, it doesn't specifically tell us there's ovarian or oviduct adenocarcinoma, but it helps us sometimes get an idea of other things that could be going on or could be contributing causes that maybe we can rule out by doing this particular type of testing. And just a note, I'm saying ovarian and oviduct adenocarcinoma, but the ovary and the oviduct are two different parts of that reproductive tract. But the reason I'm lumping them together is because it can be difficult to tell the tumor of origin sometimes with these. Sometimes it's hard to say, is it originating from the ovarian tissue or is it originating from the oviduct? And the pathologists who read these samples sometimes have a hard time saying that and differentiating between the two. So sometimes I get a biopsy back and the pathologist says, I can't tell which exactly it started from. Sometimes they're very clear and say, oh, this is ovarian or oh, this is oviductal, but sometimes they have a little bit of a hard time. So it's just something to be aware of may happen with getting a biopsy like this. Here is a picture of a chicken that had ovarian adenocarcinoma. And what it's showing here is if you look at this tissue, this first one on the left here, this first image on the left, underneath my finger up here, this pink tissue with the little like red lines across it, that's actually some normal oviduct. And then when we come down here, we have all these little white spots, and you can see it better on this central image where we have these little white spots on top of this organ here. That's honestly a little hard for me to tell. Is that reproductive tract or is that intestines? And in fact, it was intestines. And then this back here is ovary, and it has all these like white lumpy little and white to even some more cystic looking areas that are quite abnormal lumps. And we were able to remove part of the oviduct. We weren't able to get everything out, but we were able to at least resect some tissues. And you can see this is the oviduct here sitting in a little jar that has definitely some irregularities to it. But this was a chicken that was confirmed to have ovarian adenocarcinoma, but it had metastasized. So that's what these little lumps are on other structures, was metastasis to other locations. Now, the treatment for ovarian or oviductal adenocarcinoma would be surgical removal, which is what you're going to hear as well for the vast majority of these cancers is, can we surgically remove this? That being said, surgical removal is not without risks, particularly for these types of cancers. By the time we often are able to diagnose them, sometimes they are more advanced than what we would like. As you just saw in the last image, there were little metastases that this cancer had to other tissues. And so, I may be able to remove a portion of what is present, but I may not be able to remove the full thing. Or sometimes those metastases actually have like a lot of fibrous connective tissue and are having adhesions develop, which is basically like connective tissue that sticks two organs together when they're not supposed to be. And that can be really complicating because that can make it so that I may want to remove this mass, I may want to debulk it, but it may be stuck to something else like the intestines. And if I go around and try to remove this, I might cause damage to those intestines. And obviously that could be a death sentence for the bird. Also, when it's on the ovary itself, that becomes quite complicated because the ovary normally is really well adhered to some major vessels underneath it, kind of running along the back part of the body. And if I go to try to remove that ovary, it's really hard to get to those blood vessels safely. And I could potentially damage those blood vessels, leading to even fatal hemorrhaging. So we often do not recommend removing an ovary when it's affected because of that major potential for a complication. So what else do we have available to us? Well, there's also hormone therapy that we can do. Hormone therapy is where we give them certain hormones that may have some benefits at delaying progression. Now, I will say that we don't have good studies on this, but I have used it and known various other veterinarians who have used it. And anecdotally, it does seem to help some. So it is something that we have as an option to support these birds. Now, again, depending upon when we get to actually diagnosing them, we may be beyond the point where hormone therapy is going to be helpful. But honestly, that's also sometimes really hard for us to tell because we don't have good studies. The point at which we can say, oh, this is going to be helpful versus this is not going to be helpful really needs still to be determined. Okay, the last one that I'm going to go over, I think that I'll have time for today, is we're going to go from the girls to the boys, and we're going to talk about testicular tumors. So again, I have an anatomy picture here. This is up along the back part of the bird. Here is the vent down here, and we have our testicle on either side, a right and left testicle. The picture is just showing a bird in breeding season versus not breeding season. So not breeding season, the testicle is quite small. This little tube is called the vas deferens. It's where semen actually travels down to get out to the cloaca. And it's also quite thin and thread-like. But during breeding season, the testicle can expand significantly in size. And then so does that vas deferens, becomes much more thick and obvious as to what it is. And of course, these are sitting also next to the kidneys. So testicular tumors is a cancer of the testicle. And there are actually various types of testicular tumors we can see. There's what's called seminomas and Sertoli cell tumors. Those are probably the most common ones that we actually see. But we can also see interstitial cell tumors, teratomas, lymphomas, and undifferentiated sarcomas have also been diagnosed in the testicles of birds. But by and far, those first two, seminoma and Sertoli cell tumor, are probably the most common ones we see. Of course, where is it located? Well, it's on the testicles. So the way birds may present with this, sometimes one of the first signs is hind limb lameness. I'm going to go back to this anatomy picture here. And it shows our testicle kind of overlying the kidney. Well, what it doesn't show is right behind that kidney is actually nerves coming out from the spine leading to the hind limbs. And so if we have a testicular mass that's growing quite significant in size, it can push on those kidneys, and then that can then push on the sciatic nerve leading to the hind limbs, and that can cause them to have some limb lameness. So they're not able to use the limb as well as normal. They may also present with just abdominal swelling, because if this testicle is quite large, it's going to take up a lot of space. You may actually feel that sort of swelling on the belly or see it. Just as the girls can present with difficulty breathing because they've got this big thing in the abdomen, the boys can too. And the girls often present with difficulty breathing because there's fluid that develops secondarily. Males tend to not get fluid development with their testicular tumors, but just the size of the testicle itself can kind of put pressure on those air sacs and, cause breathing problems. They may just present for being lethargic. And then one thing, I guess, that is sort of a benefit in the budgies is the male budgies tend to have a blue cere. And when they develop testicular tumors, particularly the seminomas or the Sertoli cell tumors, that blue cere actually starts to become not as blue. And you can see this individual, this is all the same bird. Here he is normal with a normal bright blue cere. And here is when he presented because something was not quite right with this bird. The cere was starting to become duller and starting to get these crusting. And you can see it here where, okay, they're still blue, but it's not as that vibrant blue as it was before, but we're really starting to get this crusting develop. That's what happens in the females normally under estrogen control. And so testicular tumors actually sometimes can produce estrogen. Normally males aren't going to have any estrogen that is causing this sort of change, but when they have a testicular tumor, they can produce estrogen and it can cause this change. So this is a Bujerrigar specific change. And so if we see this change, this is something that we will say, okay, I'm worried about a testicular tumor in this bird, but it's very specific to the budgies. And unfortunately, sometimes there's no signs. I've absolutely had that before where I've had a male bird with testicular tumors that we identified on post-mortem analysis where the bird had zero signs whatsoever. When we're diagnosing this, again, clinical signs with the males with a cere color change is one thing that we may see, but then we also may have take some radiographs and actually see some changes. So we have this bird here where we see this very big abnormal thing in the abdomen, and we have it here too, this big circular structure. That is not normal, and that was found to be a testicular tumor. But on the X-ray, all I can say is there's an abdominal mass in the region of the testicle, because it could potentially be like the cranial pole of the kidney that's big, or maybe it even could potentially be the spleen that's big, or there could be some sort of infectious thing going on there that's causing some, changes. So we have to take a biopsy of it to actually know what it is. We may also see something called osteomyelosclerosis. And I have this female bird because you can see it has an egg, but just as an example of osteomyelosclerosis, see how bright white these bones are back here on her hind limbs versus like these bones here, like you can see that there is a lucency in the center. These are more normal bones, but under estrogen stimulation, normally they will release more calcium from their bones and they get this sort of dense appearance. The males can get that when they have estrogens from testicular tumor. So we might see that on an X-ray in a male bird and go, oh, that's a concern. CTs or endoscopies are other ways we can go about diagnosing this. And really, the way we need to diagnose it is biopsy more. So, but I will say on blood work, sometimes these guys give us a little bit of a clue in that they can have high fat levels. And just to quickly go over this one individual case, and then I will take some questions here. This was a bird who had came in just for getting some wellness blood work done, and we did some wellness blood work, and it had high fat levels. I have over here the dates that it came in, some changes on its CBC, its chemistry panel, and then some treatments that we were doing with this bird. But the big thing is we identified it had really, really high triglycerides, 2,628. And then we were like, oh, that's weird. I wonder what's going on. We just started him on some fish oil because fish oil is something that has been found to lower triglycerides. But on his recheck, he was even higher. And he started to have increases in his cholesterol, and then his liver values started to increase. We ended up taking x-rays, and on this side here, we have a normal bird x-ray that is supposed to look like normal, symmetrical, what we call cardiohepatic silhouette. I can't see any testicles. And then on this image, we can see this very large testicle that happened on this bird. So we have our initial images, and we talked with the owners about what can we do here. We talked about surgery, but the risks associated with surgery, with the big risk being potential for bleeding, because that same issue that we have with the females with ovarian adenocarcinomas, of the ovary being really closely adhered to some important blood vessels, well, the testicle is too. So they can be a little bit tricky sometimes to get out. So we ultimately decided we didn't want to go the route of surgical with him, and we decided to do some hormone therapy. And hormone therapy that we can do is things like Lupron and Dedlarelin. They're very similar. One's an injectable form, one is an implant. Radiation is also an option for testicular tumors. I haven't had any patients do that, but that is something that could potentially be done. But this bird here, we decided, let's go with hormone therapy. And after a month of hormone therapy for this bird, there was a dramatic difference in the size of the testicular tumor. You can see it here, but it's hard to see. It's almost like very close to that normal bird. And you can see it here too, but look at the difference between how wide it is here versus how much smaller it is. And then I have up here at the top, you can see after several more months, you can barely even see it. And then 17 months, hard to identify. Unfortunately, he did eventually have a cessation of that hormone therapy active for him, but he got a lot of time. It did eventually grow, and unfortunately, he was euthanized at this point when it got quite large. And this is the tumor itself. It's over here as well. It's actually, this is part of the liver up here and a part of the GI tract. But it was found to be diagnosed as a seminoma for this bird. So he got a lot of time though, which we were really kind of glad that he got so much time. Okay, I'm going to actually stop sharing at this point. I know I'm like 1 minute away, but any questions that I can answer for anybody? Sorry, I went a little bit longer. It's just so much information for you guys.
Oh gosh, no, seriously, that's it's a lot of information and you do a great job handing it over to us. So a couple questions for you, Dr. Lamb. One person wanted to know if the chicken has this cancer, will they still lay eggs? If so, will the eggs have cancer tissue? Just interesting.
Oh, Great question. So the vast majority of them do stop laying eggs. I have occasionally had some birds lay abnormal eggs still, despite having cancer. I don't actually know if they have any cancer cells within those eggs. That is a great question and certainly something for somebody to look into. The vast majority of the time, though, they do usually stop laying.
Okay. And then we had a viewer who lost a 5-year-old blue front to liver cancer. And one of the vets from Texas A&M stated that in their experience, indicated a much higher incidence in parrots, possibly due to breeding a recessive gene. Do you know if this is possible?
Well, unfortunately, we know that cancer is a genetic abnormality. Like something happened with the normal gene sequencing, and then cancer cells are able to overgrow. And we do see animals who have sometimes been bred more for their looks than for health. And sometimes we do, unfortunately, see birds or other animals developing cancers at young ages that we really normally shouldn't. And there may be because of some genetic component to it. I think there's still more we need to learn about that, but I do believe that it is actually a problem. Yeah.
Okay. Oh gosh, I think that's you went through that was very thorough and thank you. I mean your PowerPoints and everything are all so easy to makes it easier to kind of rewatch and relearn,
Yeah.
and we'll be on with you in May for part 2 of this series. So that'll be, I mean, this is definitely, I can just tell by the amount of participants, this is a topic that people definitely want to learn more about. So I just sorry, real quick, I got to announce today's giveaway winner because it's going to go out to Barbara Bingham. Congratulations, you're going to get some strawberry Nutriberries, which are back for a limited time, and also another Nutriberry, or sorry, Lafeber product of your bird's choosing. So Dr. Lamb, again, thank you for this. I don't know if we really have done a deep dive into this topic before, have we? Like,
I don't, we've mentioned it here and there a little bit with other problems, but not this in depth.
okay, okay. Thanks again. We'll be back next Friday with Ask the Vet with Dr. Tom Tolley. So join us then if you have any. Bring your questions to Dr. Tolley for next Friday. And Dr. Lamb, once again, thank you so much. We'll see you in May for part 2 of this series, and look forward to seeing you then. All right, guys.
Yeah.
Have a great weekend. All the best in your flock. Till next time. Bye.
Bye.